Hi everyone, my name's Sophie Milner and I'm here from the Terrence Higgins Trust Sexual Health and HIV charity. So today I'm here to talk to you about preventing sexually transmitted infections by the use of condoms. Now, although Terrence Higgins Trust does have services that run across the country, today we're going to be looking at services that are based around Southend, Essex and Thurrock. Before we go on to talk about condoms, it's important to remember that you should only be having sex if both you and your partner give consent for the type of sex that you're having. Now, it's not true consent if someone is being forced, pressured, or manipulated into having sex, and that person also needs to have the capacity to give true consent. Now, if you're concerned about the type of sex that you're having, it's really important to talk to someone, whether that's your local sexual health service or us here at Terrence Higgins Trust. We would make sure that we either support you or find the appropriate support that you need. Okay, so we're going to start the presentation. And I'm just going to share my screen with you. Preventing sexually transmitted infections. So, sexually transmitted infections, also known as STIs, are an infection that's passed from one person to another through sexual contact. So the infection is passed when a bacteria, virus, or parasite enters and grows in or on the body. Some STIs don't have any symptoms, so people can unknowingly pass it on to their sexual partners. So often STIs like chlamydia are known for being asymptomatic and people can unintentionally pass it on. STIs can affect anyone of any sexual orientation, race or gender that is engaging in sexual activity without taking precautions to protect themselves. Barrier protection, such as internal and external condoms, help stop the exchanging of bodily fluid and skin-to-skin contact, helping to prevent against sexually transmitted infections. So how to prevent them? Many of you have probably heard about different types of contraception, including things like the contraceptive pill, the IUS, the IUD, and the contraception injection. Now, these are really good examples of contraception that can help to prevent a pregnancy from occurring when having sex. Today, we're going to be looking at barrier forms of contraception, internal and external condoms. Now, not only do these provide protection against pregnancy, if there is a pregnancy risk with the kind of sex that you're having, but they are also the only form of contraception that provides protection against sexually transmitted infections. Although there are new other ways that can help to prevent the transmission of HIV, such as treatment as prevention and PrEP, we won't be looking at any of them today. So to begin with, we're going to look at external condoms, which are also known as male condoms. They stop the exchanging of bodily fluid and skin-to-skin contact, helping to prevent against both pregnancy, if you're having vaginal sex, and sexually transmitted infections for vaginal, anal, and oral sex. So condoms are a thin latex sheet, and they also come latex-free. And like I say, they create a physical barrier. Condoms can be used for vaginal, anal, and oral sex. If a male condom is used consistently as a form of contraception for vaginal sex over the course of a year, they would be 98% effective in preventing pregnancy. In order for a condom to be effective, it has to be used correctly. And now I'm going to do a condom demonstration to show you the things to look out for and the do's and don'ts when using a condom. Okay. So here I have a condom demonstrator and a condom. So the condom that I'm using today is a Passante regular condom. Now, before we use the condom, there are a few things that we need to check. So first of all, we need to check the expiry date. So this expires in 2024. So I know that this is still in date. If a condom is out of date, then it's more likely to rip or tear because the material is likely to weaken quicker. We need to look for a CE mark and a kite mark. Now you can't see these on the condom, but on the next slide, I'm going to show you an example of what marks you need to look for. Now, these just mean that the condoms have been tested to a safe standard. So it's really important that the condoms do have these marks on them. Now, what we need to do is check the packet to see if there's any damage. I can see this packet looks pretty undamaged, but we can also squeeze the packet to check that it's airtight. So this packet still feels airtight, feels quite bouncy there. Now, when you undo the condom, don't use your teeth or scissors because you could cause damage to the condom. Condoms are easy to undo. You just squeeze the condom over to the side before you tear down the edge there. So the condom has a jagged side on the top there, and that's the side that you use to peel the condom. So when you get the condom out, the condom can go on one or two ways. Now, there is a right way and there is a wrong way. What we need to do is roll the condom down. So in order for us to do that, the rim of the condom needs to be on the outside. Now here, the rim is tucked underneath the condom, so it's going to be difficult for us to roll that condom down. Now, if accidentally we started to put the condom on and realised it was the wrong way round, we would never advise to flip the condom over. We'd always advise to use a whole new condom. Now, the reason for that, there could be pre-ejaculation on the end of the penis there. That pre-ejaculation is now inserted inside this condom. And if we flip that round, this pre-ejaculation is then going to be inserted into the vaginal passageway or the anus, depending on what kind of sex that you're having. So it's important to check the condom is the right way before it goes near the erect penis. So when the condom is near the penis, squeeze all the air out the top and then roll the condom all the way down to the base there. Now, when you've finished with the condom, hold the condom as you withdraw, and that just makes sure that the condom stays on the penis. Now, there's still some checks that we need to do when you've finished with the condom to make sure that the condom has remained safe throughout the sexual activity. So, we've taken the condom off there, and we need to just tie a knot in the top of the condom. So once you've tied a knot in the top of the condom, just run your fingers down and check to see if there's any rips or tears or any fluid coming out the bottom. Now I can see that this condom has no rips or tears. So that would indicate that the condom has remained safe. Now, if there is a rip or tear in the condom once you've finished using it, we're going to take a look at what considerations you need to think about. We also advise when you finish with the condom to wrap it up in some tissue and pop it in the bin. We would never recommend to put a condom down the toilet. We also would only ever recommend to use one condom at a time and don't use an internal and external condom at the same time. Condoms are also not reusable. So once you've finished with a condom, you dispose, and the next time you have sex, you'd use a new one. Okay, so just to summarise some of the points that we've spoke about. Checks on a condom for safe practice. Check the date of expiry. Check for damage to the packaging and condom. Check for the kite mark and CE mark on the pack. So you can see there the marks at the bottom of the slide there. Check the condom is the right way up. Check the condom for splits after use. Now, if you use a lubricant, ensure to use a water-based lubricant and not an oil-based lubricant, because that can actually cause damage to the condom. Internal condoms. So internal condoms can also be known as female condoms or femidoms. So like an external condom, they create a physical barrier stopping the sperm from the penis coming into contact with the vagina or frontal hole. They are similar to external condoms, except that they're used and inserted into the vagina. So similar checks need to be made. They're best inserted by lying down or squatting and squeezing the flexible inner ring at the closed end of the condom to make it longer and narrow. So before carefully inserting it into the vagina as high as it will go, you should then use your middle finger to push the inner ring as far up in the vagina as you can, and the outer ring should be outside of the body. Internal condoms have a slightly lower level of effectiveness, around about 95% if they're used correctly. When using internal condoms, you need to make sure that the penis goes into the condom and not between the condom and the vagina, because then it wouldn't be effective. These are not as widely available as the external condom, and they can be slightly more expensive to buy. We're also going to look at dental dams. Dental dams are also known as oral dams, and they're a soft latex sheet that can be used to cover the vagina or the anus during oral sex. Like condoms, these can also come latex-free. The aim of the dental dam is to help prevent skin-on-skin contact and the exchanging of bodily fluid. Although these are sold to support preventing the exchange of sexually transmitted infections, there is limited research that supports this. So, what happens if a condom breaks? There are two types of emergency backup contraception after unprotected vaginal sex to help prevent a pregnancy from occurring. These are known as emergency hormone contraception, or sometimes EHC for short. The first one is Levenel. Levenel is effective for 72 hours after unprotected sex or condom failure. The second one, Ella1. Ella1 is available for 5 days after. You can access both of these from your sexual health clinic, GP or pharmacy. Although bear in mind that if you do purchase this over the counter, it can cost between £20 and £30. If you believe that you may have been exposed to HIV, you can be assessed for post-exposure prophylaxis, also known as PEP. This is a combination of HIV drugs that can help to prevent the virus from taking hold in your body. To work, PEP must be taken within 72 hours, but ideally within 24 hours. So it really is important, if you are concerned about HIV exposure, to be seen as soon as possible. You can be assessed to see whether PEP would be suitable for you at a sexual health or HIV clinic. If it's the weekend, it would be best to go to an accident and emergency department rather than waiting until the Monday morning. So we know that condoms are really effective at preventing sexually transmitted infections, but we also know that sometimes people don't choose to use them. So we asked people why they don't use condoms, and these are some of the responses that we had. They don't fit me. Penises come in all different shapes and sizes, and luckily so do condoms. So if a condom is too small, it can be uncomfortable and it will be more likely to burst. If it's too big, it's more likely to come off during sex. Smaller condoms are often marked as snug, trim, or close fit, and larger ones as extra large or king size. I'm embarrassed to ask my partner. Sometimes it can be tricky to have the conversation with your partner, which is why it's always best to bring the subject up long before the sex starts. Remember, a partner might actually be relieved that you're the one that's brought the subject up. It's also worth considering, if you don't feel comfortable to have these conversations with your partner, do you think that you're going to feel comfortable to be having sex with them? Remember, you should never feel pressured into having sex, and if you are worried or concerned, speak to organisations like the Terrence Higgins Trust or your local sexual health service to get support. I was caught in the moment. It can be easy to be caught in the moment, and often people feel that if they have to stop to put a condom on, it can be a passion killer. It's useful to have them somewhere that's easy to get hold of, like a bedside drawer, a wallet, or a bag. Remember, if you've already had the chat with your partner, it won't come as a surprise, and it will show that you're taking responsibility. It doesn't feel as good. Some people say they experience loss of sensation when using a condom. Just like there are different sizes of condoms, there are also different styles and even flavours. If you're worried about loss of sensation, it might be worth trying a thin, light or mate skin condom. Some condoms also come as ribbed and dotted, warming or tingling, which is designed to increase sensation for both partners. If a condom interferes with your erection, there are a few tricks you can try to help prevent this, such as gripping the base of your penis before you put it on, trapping the blood to help get your penis hard. You can also try practicing putting the condom on and off when you are alone, so that you're used to the sensation of wearing a condom. If that doesn't help, you can always try using an internal condom instead. My partner doesn't have any STIs. Sometimes people might not even know that they have an STI. Although some STIs like genital warts can sometimes be visible on the skin, other STIs like chlamydia might not have any symptoms, so it can be easily passed on without even realising. You don't have to have had sex with lots of people to catch an STI. You could have sex with just one person, and if you don't use a barrier condom, you could catch an STI. There's only one way to know if you have an STI, and that's to be tested. She's on the pill. The pill is great at preventing a pregnancy, but it provides no protection against STIs. Also remember that the contraceptive pill is only as reliable as its user, and if your partner forgets to take some pills, this method won't be as reliable. My partner is undetectable. If your partner is living with HIV and is adhering to their medication and are undetectable, this means that they won't pass HIV on to their partner with or without a condom, which is great news. However, they can still pass on other STIs like chlamydia, gonorrhea, syphilis, and if there's a pregnancy risk, you still need to think about this too. Finally, it's important to know where you can go for advice and support locally. Remember, sexual health services are there to help you and they offer confidential services. The only time a sexual health service would break your confidentiality would be if they deem you or someone close to you to be at a serious risk of harm and they need to pass information on to keep you safe. Even though the legal age of sex in the UK is 16, if you are under 16, you are still entitled to free sexual health and contraceptive services. Please don't feel embarrassed about speaking to a sexual health professional about sexual health because they are non-judgmental and they're there to support you. The EC card is a scheme for people over the age of 16 to gain access to free condoms. It's an app that you can download on your phone. You would need to watch 3 educational videos online and then complete the online test. The electronic C card would then allow you to pick condoms up for free from a number of locations locally. THT condoms by post. THT also provide online information around sexual health advice and support and other online services, including telephone counselling and support for people that's living with HIV. So we'd really recommend our website to go www.tht.org.uk, and there's lots and lots of information around sexual health. If you live in Essex, Southend and Thurrock, you can also go on our website to order free condoms by post, and the condoms will arrive in a discreet package. Southend Sexual Health Clinic. You can visit www.sshs.org.uk, and on the website you can find out more information about the service, and you can also order home testing STI kits. Again, these kits will arrive in discreet packages and they will test for chlamydia, gonorrhea, syphilis and HIV. You can complete the testing kits at home and you will pop them in the prepaid envelope back in the post, and you can have your results by either text message, phone call. If you wanted to speak to someone from Southend Sexual Health Service, you can call 0300 303 2693. The same information is available on Essex Sexual Health website, and the telephone number there is 0300 003 1212. And the same for Thurrock Sexual Health Service, 0300 303 9970. If you do have any questions or queries around any of the content that we spoke about today, please feel free to message the team at essex@tht.org.uk, and we will be happy to answer any questions. So thanks for listening to the information today, and I hope that you found it useful. Remember, if you do have any questions, please do get in contact with us because we are here to help. Thanks again. Bye.